listening to Planet Vero Radio. I am Cindy Schwartz, and this is the Patient Partner Show. We're broadcast on 101.7 FM Real Radio WCZR, and then this is podcast on Spreaker and distributed on its platforms. Jeannie Roller's talking today. What do we got, Jeannie Roller? We're talking about chaperones in the medical setting for procedures, and we're also still talking, and we will continue to talk about dignity and respect in procedures and in the medical appointment offices and stuff like that. Offices for medical appointments, I should say. Let me word that the right way.
Right. And Cindy, this is the same old, same old. Let me start with what happened today. My husband went to his cardiologist for his yearly exam. The medical assistant comes in. She says, she's going to take his vitals, and she automatically tells him to take off his shirt. She doesn't ask him. She doesn't say, please. She says, take off your shirt. And he's like, no, I won't. And she says, I need it off for an EKG. And he said, I'll unbutton it. Well, it needs to be untucked. And so then she takes his blood pressure and listens to his lungs and then has him to lay down for the EKG. And I was just like, screaming in my head, why is this happening? Because you do not have to have a person halfway naked to listen to their blood pressure or to listen to their lungs. Mm-hmm. There is no way that this stuff should be happening. And my mind was screaming, do you do this to women too? Mm-hmm. Do you make them naked from the waist up to do this stuff? Because unnecessary nudity and medical treatment is just, it runs rampant. There's no stopping it. And this particular medical practice, we had given them information that my husband was a victim of medical sexual assault. Mm-hmm. We have given them information from medical patient modesty. They know all this. It should be noted in his file, but yet they keep doing it over and over and over again. Where and when does it stop? Mm-hmm. When does the unnecessary nudity stop? Okay, which brings me on to the next thing is I came across an article written by a doctor, Dr. Christine Coy, the patient case against requiring medical chaperones. Mm-hmm. And what she says, while it sounds good in theory, it falls short in practice. There are some hospitals and some doctors' offices that require you have a chaperone. You cannot refuse them. They do not believe that your person, whoever you bring with you, is the appropriate chaperone. It has to be someone on their paid medical staff, which calls into question, who are they protecting? Is it them or the patient? And the answer to that is they're protecting themselves. Mm-hmm. The other thing is that there is no hard and fast rule of how a chaperone is supposed to conduct themselves in the exam. Do they sit there and stare while you're having your pap smear? Do they turn? Do they go behind a curtain? What are they supposed to be doing? From doctor office to doctor office, it may vary how they act and what they do. The training, there is no hard and fast rule what type of training that they have to have. In some states, they could take a 2-hour online course and become so-called trained. Mm-hmm. Other cases is if a doctor needs a chaperone and there is no supposed medical assistant available, they might yank in the girl from the front desk to be the chaperone. I mean, where is the dignity and respect for the patient's right to bodily privacy at this point? Mm-hmm, mm-hmm. It's just these things on the chaperone thing. To me, I'd rather not have a chaperone. I feel that they are an unnecessary violation of my bodily privacy. They are not there for me. They are there for the medical provider. Mm-hmm. Because there are so many cases that have been in the news where a chaperone has been present, but yet, people are getting sexually abused or assaulted. So what good is a chaperone if their salary is being paid for by the medical staff? Mm-hmm. Or, whose name's on the check?
Right.
Is it
Right. Mm-hmm.
Most people will not speak up because they don't want to lose their job.
Mm-hmm. Well, they don't want the backlash from whatever it is. I mean, we've talked about whistleblowers, and look what happens to those poor souls when they're trying to do the right thing. So, I mean, my thoughts on it, my opinions on it, first of all, back in the day, again, here we go, the people that were the chaperones, and I'm not saying that it was things didn't go awry, were actually medical people, RNs, LPNs, those kind of things, or maybe, what do they call it, male, I can't think of the word, orderlies, exactly, good word, that were schooled in the medical arena. I'm sorry, but a medical assistant is an office worker. I mean, they learn, right. Some of them learn how to do blood pressure. And I asked the ones in the different procedures that I go to what their training is. And you're exactly right. Some of it is online stuff, or they went for a weekend or whatever. And I just sit there flabbergasted that this is the medical person that they've, entrusted my care to. And one medical assistant didn't even know how to do the blood pressure. If you couldn't use, and this is just recently to an appointment I went to, if you couldn't allow her to use that electronic one, which didn't give an accurate reading, and my own doctor said that person couldn't use the old-fashioned, where you put the air in on the cuff that actually goes onto your arm with the Velcro and all of that. So, I mean, that's just one point, but so who are these medical assistant chaperones and that we got going in the procedure with us? To me, they're just people they hired off the street, literally, because they're not trained in the medical stuff. I mean, except for the one iota of the job that they do. And again, this is all my opinion. And what was the demarcation line, I want to ask, when I wasn't a human being any longer, and that my rights and my dignity and my respect didn't matter anymore, and that now that I'm going to, as I was told, and I'm with you totally, Jeannie, with your husband, from an LPN, that lady, get used to this. This is, like big box medicine. This is corporate medicine, and it's the way it's going to be. So get used to it, lady.
Right.
And that's what they told me.
Right.
And I'm like, oh, my goodness, I want to just tape this so I can play it back to you and you can hear your inflection, first of all, that I'm not even a human being anymore. It's crazy. And that stuff should all be in your husband's record. And I'm sorry, I can hear listeners saying, well, he's a man. What's the big deal about taking his shirt off to his waist? Well, you ask men that have been sexually exploited and sexually abused and whatever, they don't want to take their shirts off. They don't know what's going to happen next. I don't blame them.
Well, yeah, and the thought of some woman just saying strip, basically.
Right, yeah.
It sets off alarm bells.
Yes.
So, yeah.
It's a trigger.
Yeah, and that's what I told the doctor, that while some men may not have an issue with this, he knows his circumstance and he knows this is a trigger.
Right.
So, why the unnecessary nudity? It is not necessary. You said, well, was she doing the EKG? No, this was long before she did the EKG. I said it was a matter of convenience for her. That's what it was all about. Just do it now. While I'm messing with this paperwork, I don't care about you as a person.
Right.
I want my convenience.
My convenience, right.
And that's, right. And that's the thing. And this doctor in this article brought up, well, as a patient, she doesn't want a chaperone. She wants her bodily privacy. And that she thinks having a chaperone erodes the trust between doctors and patients, which I also agree, because I don't want someone in there, and if I cannot trust that doctor, then I don't want to go to that doctor.
Right.
That's my opinion. And I just think this has all gone too far, because there are, as I said, there are too many cases where these chaperones aren't actually making any difference in the patient's safety, because they just, see no evil, hear no evil kind of thing. And someone gets harmed anyhow.
Well, they're put in an awkward position, in all honesty. They are also put in an awkward position, I mean, in my opinion. We got like 10 seconds left, Jeannie. I get you. I totally get you. I do. So on that note, here we go again. Here's a doctor saying, people are being disrespected. I mean, when are we going to be heard? A lot of these people are saying we're not going to be. You've been listening to Planet Vera Radio. Stay tuned.